Hey guys, this is Dr. Herb. In case you haven't subscribed, please do subscribe for updates. Papulosquamous disorders. So what are present in the papulosquamous disorders? So there's presence of lichen planus. So there's lichen planus. Next is the presence of the psoriasis. So lichen planus is present, psoriasis is present. Then comes the presence of the parapsoriasis. So there's parapsoriasis. Then is the pityriasis. So this pityriasis, rubra pilaris. Rubra pilaris. Next is the pityriasis rosea. The pityriasis rosea. Next is the seborrheic dermatitis. And next, secondary syphilis, drug reaction Reiter's disease, then comes the eczema neoplasms. So when you look at neoplasm, it can include the mycosis fungoides, we are writing it as MF, then the squamous cell carcinoma, as well as the Bowen's disease. Next, it includes the tinea infections as well. So there is presence of the tinea infection as well. To learn and grow daily like this, please do subscribe.